Welcome to Progress in San Diego, Ordinary People Doing Extraordinary Things. I'm your host, Walter Davis, and this evening we have the honor to have Dr. John Jimenez of Interactive Cancer Therapy Centers. Welcome to the show, John.
Thank you. Thank you for having me.
So, you have a very unique treatment approach to cancer as opposed to what we may consider to be ordinary or standard medicine. Actually, I think that that's really the alternative medicine.
That's correct.
The thing they call alternative medicine is really the real medicine, in my opinion. I'm a cancer survivor myself. I use totally holistic treatment methodologies, and we had a brief conversation about that. Mm-hmm. So with that, I'll turn it over to you. What do you want to tell the public about you and your background?
Well, I'm originally from New Jersey. I was actually born in New Jersey, grew up in New York City. I started loving science since I was a kid. I come from a family background of mainly doctors and lawyers, so I chose medicine. And I went to university here in the United States, biology major. Then I studied medicine in general medicine in Mexico. Then I went overseas to specialize in non-traditional practice of medicine, which includes natural medicine, alternative medicine, or there's so many titles nowadays for that type of medicine, holistic medicine, which we were talking about yesterday, and I was talking to some friends earlier that traditional medicine really is the real medicine, but they call traditional medicine now what the medicine that the orthodox medicine is today.
So, yeah, generally what we consider to be traditional medicine is really the alternative.
Correct.
And so some of the things that I understand you practice are things that have been around for millions of years, yet some of the new things on the scene now are considered to be traditional medicine, when in fact they are the experimental things. And so we've gotten away from some holistic things that are much more beneficial to the human body in terms of not destroying the cell structure, not compromising the immune system, and things of that nature. Am I correct?
That's correct. Well, 200 years ago is when the medicine that is practiced today, 90% of the medicine that is practiced today is when it was established. Prior to that, mankind was actually healing the body naturally. So there's a lot of us now, doctors and health practitioners, that have gone back to that. In school I study orthodox medicine, which is what modern medicine is right now. But obviously I went a different way when I specialized, and I opted to study natural way of healing all diseases. Even though one of my strong points is cancer, I pretty much could treat any disease using non-toxic, safe, and effective therapies to heal the body. My approach and our approach that we establish is to heal the body, the mind, and the spirit. So this has a strong effect, and this is why we have 80 to 90% success rate with a lot of diseases. It's mainly cancer.
Tell me about that. Tell me about some of the treatment methodologies that you use.
Well, the way that we see patients, we have to deal with the emotional aspect of the patient. For example, a cancer patient is going to have emotional problems. Just even if they didn't have an emotional problem prior to the disease, when the oncologist says you have cancer to these patients, right away their whole world is turned upside down. So there's an emotional effect right there that's going to lower the immune system right then and there, even at that doctor's office or at that phone call that they get at home. So right away we have to deal with that emotional state of the patient. Now, do we get patients that the doctor tells them you have a month to live, you have 6 weeks to live, you have 3 months to live? I don't know about you, but these doctors, I don't know if they have like a line from the man upstairs saying, hey, tell this guy he has 3 months, tell this guy. So that's an issue we have to address right away. We have to find out what state the patient is in, what emotional state, and then go from the emotional to the physical. Then we have to do the medicine. This is why I call my practice integrative, because we use both. The physical medicine, even though we don't use toxic therapies, but we are using things that are going to help the physical body as well as the emotional body and the spiritual body, not having anything to do with religion per se. But we do have to take that into consideration. So it's a complete protocol that we offer the patient, not just, we don't just focus on the tumor itself. We have to focus on the whole body.
Got it. So when I was told that I had cancer, the phone rang at 7:30 in the morning, and the doctor said to me, your biopsy results have come back, and they're positive you have cancer. That was the end of the story. And someone will call you in the next couple of months and tell you what to do.
The next couple of months.
That's what they said to me.
Incredible.
Yeah.
Yeah. There's stories like that every day. I hear stories like that every day. Worse stories than that. And it's sad. It's really sad. That's one of our goals, is to avoid those kind of moments for people in general throughout the world.
Right. So I can appreciate what you said about treating the person's spiritual and also their emotional condition, because I was left devastated. I didn't know what to do. In addition to that, I was so afraid that I opted to get the surgery. I showed up for my pre-op appointment, and my doctor didn't show up. So I'm glad that he didn't, because that made me start looking for alternative methodologies of treatment. So I was able to use sonic treatment, sound therapy, acupuncture, colon hydrotherapy. I used poly-MVA. I used bentonite cleansing treatments, and began to alkaline my body utilizing lemon water. There's also infrared treatment and photon ray treatment, and I know you have similar things to that. Could you elaborate more? Give them the good stuff. Okay. Oh, and by the way, it took me 3 years, and I became cancer-free, and I've been cancer-free for 3 years.
I'm glad you said that it took you 3 years, because a lot of people, when they come to us, they think that they're going to get cured in 2 weeks, because usually that's the minimum stay at our centers. You're not going to get cured in 2 weeks. I mean, 2 weeks is just the minimum stay at our centers, but sometimes it takes 6 months, a year, sometimes 2 years, 3 years. We had a child about 7 years ago that came from Netherlands. He had leukemia, and they had given him everything over there, and nothing worked. They told the parents, your son is gonna probably die in 12 days. Brought him here. We started the complete protocol for this patient, and he's now 16 years old.
Wonderful.
Yeah, he's now 16 years old. So in regards to your question about the therapies that we use our main therapy, which is, first of all, we have to understand that we have to detox the body. I mean, besides getting the patient mindly correct, emotionally better, healthier, positive, we have to clean the body. For example, the liver, whether the patient had chemotherapy or not, is toxic. What does that mean? Let's think of it as a filter in a car. If you don't change that filter, right, it's going to get plugged, right?
Right.
And then the car is not going to function correctly. And eventually, something really bad will happen to the engine. Same thing with the filter. The filter, at 30 years old, we've collected 30 grams or more of toxins in the liver.
And the liver filters the blood.
Correct.
Okay.
It cleans. It cleans, right? So basically, even if we're not sick, by the age of 30, we've accumulated that much toxic substances or chemicals in the liver. This is not, I'm not even talking about people that drink alcohol or that smoke or that have, the crazy life, things like that.
Right.
So
it has to do with, the toxins in our food, using chemicals to clean our homes, changing your oil, getting the oil on your fingers, the chlorine bleach when you're washing your clothes, the toxins in eating pieces of fruit, the meats that we're eating have toxins. The animals eat toxins. They get pesticides inside of them. We get pesticides sprayed on us. So we get
a whole gamma
toxins from a lot of different areas. So I'm sorry to interrupt you, but
it's okay. Even the pool has so much chlorine. All the pools, and I have a friend. She's an Olympic gold medal, silver medalist from Canada. She's working on the pool issue, but even got her sick from so much chlorine because it's very toxic. So even things that we don't even think about or even know that exist that are so bad for our bodies, it affects us. So anyway, we could go on and on about these toxin things, but we're
But you have to clean the liver.
Yeah, clean the liver, detox. It's called a detoxification program that we do. It's through IV. It's the most effective. Why IV? Because these patients that we see, they need IV. Orally it helps, but not for these kind of stage 4 cancer patients, stage 3 cancer patients. So we do a detoxification program, IV. We do a chelation program, IV. And for those of you that don't know what chelation is, it's the removal of heavy metals that have accumulated in the blood. They have metals that don't do anything to us except make our tissues and our organs work harder. So we have to clean those out. We have to try to remove or get the removal of metals in our teeth, of the patient's teeth, because they release mercury, even though dentists say that they don't, or now they're changing their way of thinking. And there's a lot of biological dentists right now that are doing better in the mouth in regards to not putting mercury in people's teeth. So that's just a start. Then once this happens, at the same time we will introduce tumor-killing therapies like sonophototherapy, poly-MVA IV, which you mentioned, Laetrile IM. Laetrile has been around for over 60 years to stop the metastasis of tumor cells. So, and there's if you Google Laetrile, there's so many articles on it, and people say, yeah, it's good, yes, it's no good, things like that. So, but the main therapy that we use is sonophototherapy, and that's using sound and light to cause an effect in the body to destroy cancer cell. Now, how does this work? Well, in the 70s, there was a Russian scientist that introduced a substance into the body. This substance, what it did is it went around tumor cells and it attached itself to it. But it was the substance that he injected was toxic. It wasn't very effective because it did cause some really bad side effects. Now, then they introduced 24 hours later they introduced light into the body or on the body of the patient. Now, this substance that they injected, what it did is it opened up and it released oxygen. But in the 70s, what it also did, it released other toxic chemicals, which harmed the patient. So, but now, about 15 years ago, the scientists, what they did is they extracted the same substance or a similar substance that would do the same from chlorophyll, a natural substance. So basically, they made it into a capsule form. Mm-hmm. For those of us that know what the ingredients are in the capsule. Now, this is called an agent. We call it Antica, and Antica, C-A, cancer, anti-cancer. Mm-hmm. All right, so this capsule is placed under the tongue of the patient, and you give however many, depending on the weight of the patient, and the capsule is absorbed into the bloodstream, and then it goes to different parts of the body, wherever there are malignant tumor cells. It attaches itself to the tumor cells. 24 hours later, the patient is exposed to this UV full spectrum non-toxic light. It does not burn. The patient does not feel anything. But what the light does is it makes the agent release the oxygen in the tumor cell. And you know that tumors, malignant cancer cells, cannot survive in an oxygen environment. Therefore, they shrink and die. Now, there are some tumors that are too deep into the tissues that the light cannot penetrate it. So we use a ultrasound machine. It's not the ultrasound machine that most people are know about. It's a different type it's a frequency sound machine. And basically what the patient feels is like they're getting a massage in different areas of the body with a little device. They don't feel any pain. It's not non-invasive. And what this does is it penetrates deep tissue tumors because sound travels even further into the body. And then it has the same effect. The agent opens up, releases oxygen, and has that effect on the actual cancer cell.
So the agent is administered sublingually?
Sublingually,
and
under special conditions. And
tell me again, what is the agent?
It's a substance that's derived from chlorophyll.
Okay.
Yeah.
So this is sort of a patented, or this is
Correct.
okay.
Yeah, because we've got this. There's only a couple of doctors in the world that actually do this correctly. If you Google sonophototherapy, there's people that are doing it, but you have to be very specific on what the agent is and what else you need to put on the capsule so it could actually have the effect, the desired effect. Mm-hmm. Some people only use phototherapy, which doesn't help with the deep tissue tumors. So you have to be very careful on who's doing sonophototherapy and, is it the correct agent that they're using. So it's very, very... And I had, throughout the years, people have called and they would act like patients and they would ask all these questions about the agent. Well, how do I know? And what's the agent and this and that? Because, even in this community, the alternative community, there are people that want to quickly learn what took, for example, myself, 5-10 years to learn and developed, things like that.
Right, I understand.
Yeah.
How does this work on things like lymph node? Cancer that's embedded deep within the lymph nodes, is it effective on that?
It's very effective. The only cancer that the sonophototherapy does not work is in brain tumors because the agent doesn't pass the blood-brain barrier. But it does work on any other malignant tumor in the body. Now, what we do with these other patients that have brain tumors is I apply sonophototherapy to them as well as everything else for the brain tumor, like poly-MVA IV. Now, we know that poly-MVA IV passes through the blood-brain barrier. And by the way, if you don't know what poly-MVA IV is, or poly-MVA, think of it as chemotherapy, but natural. It kills cancer cells. Not only does it kill cancer cells, it gives you energy, right? It gives you strength, energy. It boosts the immune system. It's the strongest antioxidant that exists today that can be given IV. Now, for people that are listening to this show, if you go get the poly-MVA in the internet, you got to be very careful because a lot of companies water it down, and it's only sold orally. So you have to have a specific lab to get it to be accommodated IV. So you can't just get a bottle of an oral poly-MVA and apply it IV because it doesn't work that way.
Uh-huh.
Yeah. So in our protocols, we do. It's a whole process. The patient is doing the whole day. They're doing things. We have for the lymph nodes. I had a patient two months ago. She's a Hollywood director. She came with us with Hodgkin's lymphoma. Hodgkin's affects the lymph nodes. She came with. You could see the big, huge tumors, or the lymph nodes really, really swollen. And basically what we did is that's the protocol. Sonophototherapy, poly-MVA IV, detoxification IV, chelation IV, Laetrile, and some other therapies that we apply. 2 weeks later, everything is just drained out. She's in my Facebook page, by the way, and I can't tell you I can't mention it, right? But she's on there. Her testimony's there. Her testimony's on YouTube. It's out there. There are a lot of effective protocols that are non-toxic, not just mine, but then there are a lot of that are not effective. So I always tell people, you know, if you're not even going to come to mine, make sure you go to a one that really works for you.
Right. So this is some great innovation. You're talking about being able to defeat toxic cancer cells without destroying the body.
Correct.
That makes sense to me.
That's correct.
So what people don't understand is that chemotherapy can cost you as much as $32,000 per month. Radiation treatment is $700 per day, and you got to go in every day for 30 days, and it just cooks you.
Mm-hmm.
The chemotherapy can also affect the brain to where you become insane. They call it chemo brain. And so people can lose their cognitive ability as a result of utilizing some of these traditional treatments.
Correct.
And men with prostate cancer can become impotent and incontinent.
You know, on a personal note, my father was diagnosed prior to me going even to university with prostate cancer. And they treated him with chemotherapy and radiation, and he was never the same after that. I mean, he had to wear a diaper for the rest of his life. I mean, I'm not saying that every man that goes through chemotherapy and radiation has to do that, but there are a lot of problems when these things are used. You know, like I think 7 years ago they did a study internationally, and they asked oncologists, if you or your loved one got cancer, would you do chemotherapy or radiation for yourself or for your family member? You know how many of them percentage-wise said no?
No.
100% said no.
Wow.
100%.
And they don't tell people about the chemo brain stuff. They don't warn people about that. And they're also very ignorant. I went to the Moores Cancer Center and witnessed them having a bake sale. And so they were giving cancer patients and their families cookies and candy with sugar and flour. Can you talk about that? How ignorant is that?
Well, most people that are in this field know that cancer cells feed on glucose or sugar. The first thing you have to tell a cancer patient is stop eating sugar. And also, I see IVs, dextrose IVs are given to cancer patients with the chemo. That's basically nulling the effect of anything, because what's happening is that the more sugar that the patient ingests or eats, the more growth there's going to be with the cell. Because cancer cells, there's two things about cancer cells. They thrive with sugar, and they thrive in an acidic environment. Those are the two main things that I tell patients, even if they call me, sometimes they call me from Malaysia and they ask me questions, I can't afford the therapy, I can't go to your country, I can't leave this place, what can I do? I don't have any money. What can I do locally? And I tell them three things. Stop eating sugar, anything that has sugar. Try to get your pH alkaline. How do I do that? How would you do that without money or, to buy these things or these remedies? Take baking soda, put it in a glass of water, 2 spoons, mix it up and drink 5 times a day. That's going to get your pH at least to a 7, because most cancer patients have a pH of 5.5, 5.6, 5.7, around there. Now, what's happening is that in an acidic environment like that, the cancer cells are thriving, reproducing, and growing and growing and growing. One time, I guess I don't know if I'm allowed to say this in TV or public, even because of where I am in the United States, but I didn't do this in the United States, by the way, but I took an alkaline solution. This patient had a tumor right here. And this is not, I am not making this up. We use an alkaline solution that's pretty much made by our scientists that we work with. I took it and I injected 20 cc's 3 times a day of the solution. The pH was an 11 of the solution. And in 2 weeks, the big tumor that was sticking out of this patient's neck just dried up and fell. It just fell completely. Wow. I regret not taking video or a picture of this, but next time I will.
We're down to our last 3 minutes, believe it or not. This went by really fast. I want to make sure you were able to give the public the statement that you want to give them, the action statement, how can they support you, things of that nature, whatever you want to say, but you have basically about a minute to put that out.
Well, basically, one of our goals with us is to educate the people. Our mentality is we have a lot of compassion and humility for the whole human race, and we want to help educate the people on their different options that they have when they come to these situations in their life with cancer, with a degenerative disease like diabetes or hypertension, because all these things can be stopped. They can be stopped. So educating the people is one of our goals, giving them options, letting them know that there's more out there to treatment than just conventional modern medicine, and to do research, but don't do research for months and months, especially if you have cancer, to pick where you're going to go. Do the research as quick as possible, your family member or yourself if you're able to, and decide and act quick, because with cancer you cannot wait. You have to act quick as possible. So if you decide to go with me or with someone else, it's up to you, but do something. Do something positive and stay positive. And cancer is not a death sentence. It's not a death sentence.
Okay, great. Well, it's really been a pleasure to have you on the
Thanks
show.
For having
Time
me.
went by so quickly.
Thanks for having me. Appreciate it.
I want to encourage you to look for more stories that we're going to be doing on cancer and holistic treatments in the San Diego County Community Coalition and Progress in San Diego. I want to thank you very much for joining this evening. My name is Walter Davis, and I'm your host. Thank you very much.